Good morning, everyone. My name is Lorraine Lathan, and I am the director, the very proud director of the Wisconsin African American Tobacco Prevention Network, as well as the Poverty Network. And today we're here for a panel discussion related to health equity, racial justice, racial equity, and social justice within the arena of tobacco. I thought that it was very fitting to start today because this is the weekend of the MLK Day of Service, which is actually a weekend for us. So I wanted to start with a quote from Dr. Martin Luther King. Injustice anywhere is a threat to justice everywhere. And that's what we're going to be discussing today. But before we get started, wanted to kind of bring people up to speed on a few things. In terms of tobacco disparities within the state of Wisconsin, clearly we see disparities, racial disparities. We know that tobacco does not impact all communities the same way. If you look at this chart, you'll see that the state adult smoking rate is at 16%. And in other populations, it's close to double. So you look at African Americans, you look at multiracial groups, people with lower education, those rates of smoking are much higher, and that is not by happenstance. Just to frame the discussion, I wanted to share with you definitions. So definitions of equity. I really enjoy the definition provided by the Aspen Institute on Racial Equity. And basically it says that racial equity refers to genuinely non-racist society would look like. So that regardless of your race, there would be equitable distribution of resources as well as burden. And then Robert Wood Johnson Foundation, this is how they define health equity as well. And it's really giving everyone a fair opportunity to reach their fullest health or their optimal health potential. So these are the two things keep in mind as we move through the discussion today. And then also beware, I look at this in terms of a collision of racism and a number of systems and policies. And so the research is certainly showing us that when you look at health outcomes, it's odd to, well, I wouldn't say odd, but studies are showing that only about 20% of access to quality healthcare actually impacts health outcomes. So it's really those non-health factors that we need to focus on and work upstream, the socioeconomic, physical as well. Within public health, we spend a lot of time focusing on health behaviors, but we have to work, as I said, upstream and look at what are the drivers of those health barriers. Are you living in a food desert? Are you stressed out? Do you have low employment or poor housing? There's so many other factors that we now in public health are forced to focus on. I wanted to just bring to your attention a little bit in terms of we deal a lot with health equity and racial equity. And I think people are less aware of the social justice issues as they relate to tobacco. And so we have 4 images here. People can put it in the chat box and Edgar, you can take a look and see if people are able to respond. But I'm just curious if people know how tobacco intersected in the lives of these 4 people who are no longer with us. And how that relates to social justice. So if you guys, I'm going to just give a few minutes, if you could put things in the chat, and then Edgar, if you could take a look. So Eric Gardner, far left, he ended up dying as a result of a police officer in a chokehold related to him selling Lucy's single cigarettes outside of a retailer. Sandra Bland, she was stopped for a tail light or some type of problem with her car, and she refused to put out her cigarette that she was smoking and was arrested and later died in police custody. Michael Brown, he was accused of trying to steal a box of cigarillos. He also died. And George Floyd, again, was accused of passing a fake, I don't know if it's $20 or $10 bill in order to purchase a tobacco product. And so when we think about tobacco and social justice, we don't always think about social justice as it relates to tobacco, but certainly these are clear examples of intersectionality as it relates to law enforcement and the enforcement of tobacco policies. So that, I think, is what I wanted to share with you. And also just briefly, some of the things that my firm, Jump at the Sun, is working on. We're funded through Robert Wood Johnson Foundation to look at public health, at the declarations of public health as, racism as a public health crisis. Milwaukee County was the first government entity in the United States to make that declaration. And since that time, there have been hundreds of others, both municipalities, states, and governments that have made that those declarations. We're just curious as to whether or not declarations translates into action, into changes in policy, into addressing truly racism as one of those social determinants of health outcomes. We're also funded through the state minority health department to focus on how to dismantle structural racism. We've been working on some campaigns that we'll be testing. One is Racism Hurts, Speak Up, Speak Out. So you'll be receiving more information on that particular campaign. And then finally, we've signed on to a resolution that many others have signed on to related to the decriminalization of tobacco. So with that said, I don't want to take up all the time. I want to turn it over to Edgar, who will get us started with our panelists. So thank you.
Thank you, Lorraine, and I'll try to move this quickly. My name is Edgar Mendez, and I'm the Communications Director for the Wisconsin African American Tobacco Prevention Network and the Wisconsin Tobacco Prevention and Poverty Network. I just wanted to remind everyone joining us today that the views and opinions expressed today by the panelists and our guests do not necessarily reflect the opinions of Jump at the Sun, the African American Network, or the Poverty Network. This discussion is meant to stimulate dialogue on these very important issues. As far as the purpose of the event itself, as we work to confront the targeting of communities by tobacco companies and the criminalization of commercial tobacco, it is paramount that we approach these issues as opportunities to push for racial equity and social justice. The goal of the panel discussion today is to discuss and confront issues that will help guide the work of our Health Equity and Social Justice Subcommittee. One area that we do know that we will work to address are issues related to the tobacco retail environment. A little bit about our work on that issue. Prior to the pandemic, the Poverty Network created a survey to determine community awareness and perspectives on issues related to the tobacco retail environment in Milwaukee. Some of our key findings included that 70% of respondents lived within 2 blocks of a store that sold tobacco, and 3/4 reported a tobacco retailer within 2 blocks of the nearest youth serving organization or school. 80% of respondents, current and former smokers, agreed that having a tobacco retailer close to their home made it harder to quit, and 85% of all respondents favored limiting the number of tobacco retailers in their community, especially near schools. As far as the format of the discussion, I will ask a question and give each panelist a chance to answer. Please put any questions that you have in the chat, and we'll get to those questions after we complete our 35 minutes of predetermined questions. We will get to those questions or allow people to unmute themselves during a 15-minute Q&A session following our questions. We will also allow panelists a minute at the conclusion of the discussion or of all the questions for a final statement. At different times throughout the event, you will notice a link to a sign-up form where you can register for one of our weekend's MLK volunteer events, which we'll describe in full later, or for this subcommittee or one of our other subcommittees. Now I will introduce our panelists in alphabetical order of their last name. Mikel Holt is the founder and associate publisher of the Milwaukee Community Journal, Wisconsin's largest circulated African-American publication. Under his leadership, the Community Journal has become one of the state's most influential Black newspapers and is recognized as a national leader in civil rights and educational reform. Mr. Holt is also the founder of Communications, Inc., a minority-owned and operating PR and advertising firm specializing in the African-American market. Mr. Holt is a graduate from UW-Milwaukee and a longtime champion of addressing racial health disparities in tobacco prevention and control. Our second panelist, Lisa Jones, is the executive director and lead organizer of MICAH, a well-known multiracial interfaith organization committed to addressing justice issues in the community. Lisa works diligently in all avenues of her life for racial justice and equity. She has been engaged in racial justice work at both her Brown Deer United Methodist Church and in Metro Milwaukee as the co-chair of Rid Racism Milwaukee. Along with her work at MICAH, Ms. Jones has recently been working to address racial incidents in Milwaukee's suburban communities, in the schools, and police departments. Lisa's motto is, if you want to see the change, be the change. Silence and inaction is not an option. Our third panelist, Jeff Roman, assumed the role of Executive Director of the Office of African American Affairs on July 13th, 2020. Roman's appointment enables the county to play a larger role in advancing health and racial equity throughout the region. Roman is a Milwaukee native who has extensive experience mobilizing and supporting equity-based and community-centered programs, policy advocacy, and collective impact initiatives. I will now move into our questions. And this order will be the first questions of Ms. Jones, Mr. Holt, and then Mr. Roman. In 2020, the murder of George Floyd by a Minneapolis police officer sparked a movement to address police brutality and other social justice issues. Has that momentum been lost, or is the movement still going strong? Ms. Jones?
Thank you, Edgar. To answer that question, some of the momentum has been lost. I think when terrible things happen, people get energized and everything like that. But policing is a very complex issue. Obviously, you just showed the people that have been, how tobacco intersects our lives and how can it intersects when it comes to injustice and policing earlier. But I do think that there is some momentum still left. I think for those of us who are most on the ground, we have not given up, and we won't give up until there are no more deaths at the hands of police.
Thank you. Mr. Holt?
Well, following that murder, two thoughts came to mind. One was that it was eerily similar to a situation in Milwaukee that took place almost 30 years earlier, and very little change from that situation. Ernie Lacy was the killing of Ernie Lacy, who was also killed in a chokehold, etc. This was a young man who had just stepped outside of a store on Wisconsin Avenue and was approached by police officers, Milwaukee police officers, who were looking for a rape suspect. The chief of police at the time was the infamous Harold Breyer. The information, the ID for the rapist was that he was a Black man with hair on his face somewhere between 5'6" and 6'6". So everybody was stopped. They stopped, he resisted, ended up in a chokehold and it was killed. I did a comparison between George Floyd and that incident. In that particular incident, the police union threatened the DA with a recall election if he pursued a grand jury. In both cases, I think very, very little has happened. I think what really happened in George Floyd, though, which was very disturbing, but not very surprising, is that the movement was kidnapped. It became a political campaign. They used George Floyd to energize the Black vote and push for Biden. Some of his people were actually involved in the organizing of some of the marches. And as a result, we lost sight of the methodology for change. Changing police policies is a local issue. It is not a national issue. In Biden, the legislation that eventually came out of Congress was killed last September. So, you know, the key to a lot of this is if you want change in the police department, you have to deal with it locally. So they should have been dealing with the mayor, as we should be dealing with the mayor and common council in Milwaukee. But like many campaigns of this nature, civil rights, it was subverted. People, and I personally blame this on Black folks because I think that we gave the keys to the freedom bus up to so-called progressives and liberals, and they've been dictating who our leaders are, direction of civil rights, diluting certain campaigns, etc. But was the momentum lost? Yes, it was lost, but it will be regained with the next sensationalistic murder. And I hope folks have woken from their sleep and will understand how to get change through.
Yeah, so I think the answer to that question depends on who you ask. And so for me and for folk like me, my comrades, other people who call themselves freedom fighters and social justice advocates, the work hasn't diminished. Actually, it's been propelled and it's been mobilized even more. But you know, we're not the mainstream. And so for many others, I think when we're talking about has this changed, the question is, who are we talking about? Has the mainstream, has the power elite, has the white dominant culture reverted back to what it's used to doing? I would say yes, it has. But I think there's a few reasons for that. One is while you're fighting for justice, so we've been fighting for justice for a long time, decades, centuries. People of color, like it's ingrained in us. We've been doing this for a long time. But many of our systems haven't. Many of our businesses haven't. And so this is a new fight. This is a new discipline for people. And what happened 2 years ago, a whole new field emerged. Everybody's talking about racial equity. Everybody's talking about social justice. Everybody's talking the talk, but people don't know how to walk the walk. And there's a science to walking the walk. There's a practice or a praxis to walking the walk that many people don't know. And if you don't know that, and then you are in a community who doesn't have enough capacity and infrastructure to hold those in power accountable, those who are in those positions of power, those who are in the mainstream or in the elite, they revert back to the status quo because there's nobody holding them accountable. And so for some, it has diminished. For some, it hasn't changed. For me, it hasn't changed. But for many others, yes, it has. And that's because we as a community haven't been able to strengthen ourselves, build our capacity, and organize ourselves to hold them accountable for the change that they say they want to see.
Thank you, Mr. Roman. So this question, it's going to be answered in order of Mr. Holt, Mr. Roman, and then Ms. Jones. So Mr. Holt, you recently wrote a piece called The Bigger Can of Raid, which discussed the Kyle Rittenhouse verdict, one that didn't surprise you. You said it was another example of white supremacy, but warned people not to be swayed by emotionalism and partisan politics. What are your other takeaways from the verdict? And I'd also like to ask the other panelists to share their feelings about the verdict now that they've had some time to reflect.
Well, as I reflect, one of the things about being a columnist, and I've been writing columns for 40 years. Matter of fact, unfortunately, I'm the only Black columnist in the state of Wisconsin right now. But one of the things about writing a weekly column is that the day after, it's published, you read it. Well, I stopped reading it, but you read it and you say, oh, I wish I would have changed this, wish I would have changed this, wish I would have added that, etc. I would have changed that one to say that was a conflict, not of white supremacy, but of white privilege on both sides. People did, we found ourselves you know, attacking Rittenhouse, and because we viewed him as killing some of our messengers and some of our people. Number one, that was not the case. The first person who was killed was not there to fight for justice. He actually, and it's, you know, been brought up since then repeatedly, that he was walking around using the N-word. He was an anti-justice protester who got caught up in the moment. He was also a pedophile, but we won't even get into all of that kind of stuff. But what it did was it put white privilege on trial as well. We were hung up in a lot of symbolism. For example, everybody was calling the judge biased because he said you couldn't call the victims victims. I understood that clearly. You know, it does taint the perception. I assume I put in that article as well that I knew direction it was going long before the trial started, because it seemed to me to be a case of actually self-defense. I mean, if you're attacked and you don't know any better, what are you going to do? Would you just stand there and, you know, I mean, there was in his mind, you know, and he's a wannabe racist. This Rittenhouse, he's a punk in training. And now he's a global star, and he'll probably be campaigning with Senator Johnson in Wisconsin, etc. But you know, we sometimes get caught up so much in the symbolism that we don't look at the substance. If you flip the script, like it's taken, there's a case right now where a Black man is saying that he killed an attorney out of self-defense. But the judge in Milwaukee is saying you can say victim. So you got this Black man on the one hand, and you know, the prosecutors can use the term victims, but when you had this young white punk down in Kenosha, they say you couldn't. And I fully understand why you shouldn't be able to say victim. But I kind of like knew it because I know Wisconsin, I know the history of Wisconsin, and I know who would make up that jury pool. You know, you can just look far back on history and you can say, you know, he is not going to be convicted. They just have to figure out a way, you know, to justify what he did. But again, like my first impressions was it was self-defense anyway. We were caught up in the emotionalism of the time and the symbolism around this trial, and justice would not be served. You know, there's two systems in America. There's the justice system and there's the just us system. And he was part of the, you know, the justice system when we are often victimized by the just us system.
Thank you. Mr. Roman.
So you put the specifics of the case aside, the things that led up to the case. The Kyle Rittenhouse case was and is a case study in what racism is, what racism does, and how racism protects itself to maintain the construct of racialized power, privilege, and prejudice in this country, period. That's what it was. And everybody can say anything else they want to. If you take out the specifics of the case, what it was is a demonstration of what racism actually is and how it's operationalized using the power structures, using the law, and using systems to maintain a racialized social order. That's what it was. That's what it is. If anybody asks me what it was, that's what I say it is. I watched it every day, and that's exactly what it was.
Can I just piggyback on something he just said? You know, one example, you know, this whole thing about critical race theory began with a study of the criminal justice system, how racism is inherent within that system, which piggybacks, you know, with what Jeff said. But it, you know, had he, and I think I mentioned this in the column, had Kyle Rittenhouse had a public defender, he would be in prison today. But it was like $1 million bail, and he was bailed out by somebody he didn't even know. He had a dream team in terms of attorneys. In fact, he had a member of O.J. Simpson's dream team on his team. So that gets to the heart of this again. It's not just racial within the criminal justice system, it's also financial. If you have the resources, you can determine the outcome. And he had the resources, even though nobody knew him. And most of, you could easily say most of the people who contribute, were racist themselves. But he got a lot of money, from what I understand, $250,000 from the evangelical right. So what does that tell you?
Thank you, Mr. Holt. Ms. Jones?
Yeah, this case, and I agree completely with the other panelists, is totally white supremacy. It's really interesting. I do a lot of racial justice work, and MICAH is a multiracial organization. So we do have white people within MICAH, and it's really interesting for some of the folks who are my white siblings. They were shocked. They just thought that this was, kind of going to happen. And I mean, I particularly realized where this was going. Not only, it's one thing to say you can't call, but to call them, rioters and looters instead of the decedent. I mean, so there's ways to do that. I mean, even the language and how the judge was even telling folks and how he was guiding. Yeah, but here's the thing that really that gets me is that so many people were really surprised that the verdict went that way. I'm gonna be real honest. I was not surprised. Once you took that he, that him bringing the gun across state lines and you couldn't use that, I was like, it was a foregone conclusion, because that was basically, so much part of the legal part of the case. And I think it really tells, this is where we are. Now, it may not be where we want to be, but this is where we are, and this is the state of our criminal legal system. I'm not even going to call it justice, because there's no justice in the system for Black folks. It's the criminal legal system, and it's on full display. And keep in mind, Black folks did not create the criminal legal system. We just have to be subject to it.
Thank you. So this order will be Mr. Roman, Ms. Jones, and then Mr. Holt. So Milwaukee County is taking key steps to address structural racism as a public health crisis. Have these actions made a difference yet, and how will they improve the quality of life for people of color in the city?
I'm going to ask this question this way. Have they is I would say the wrong word to use. I would say, are they making a difference? And incrementally, yes. So governments, and even like communities, are very, very hard, large systems and institutions to move and change. Even those with the best intention, it just takes time to move and shape and mobilize an organization, a community institution to change. And you can't change overnight. You can't change within a year, 4 years. You can't change within somebody's term. You can't change what funders and foundations say. You have 3 to 5 years to turn this whole issue around. Like that's impractical. That's not how the world works. And inequities and injustice have been pervasive in our communities for generations upon generations. But as a government, I can speak about Milwaukee County as a government. Our leaders, past and even in the media past before the new administration, we have leaders who have acknowledged, and a government that has now acknowledged the role.
My teaching career to higher levels while helping my students excel.
All right, sorry about that. We have our leaders. We have a government that have acknowledged the ways and the roles and the way in which we have past and present contributed to the inequities and injustice in our communities, and we are now making the real commitment to doing our part to really address those barriers so that every resident of Milwaukee County can do what I say, reach their full their full health potential. And we can do it in a way where every citizen in Milwaukee County is welcome, is healthy, and is thriving. That's going to take time for us to get there yet. And so when I talk about doing our work, there's specific things that we've committed to do since we've declared racism a public health crisis. And what that means simply is that we are challenging, we're assessing, and we are putting in place and building the foundation to transform and assess the policies, the practices, and the power structures. That's the real thing. The power structures that exist within our government, within our systems, and the other systems that impact or come into Milwaukee County, so that we can do that work. And that takes time. It takes patience, it takes learning, and it takes a whole lot of unlearning. And so in Milwaukee County, we are doing a lot of unlearning right now, a lot of unlearning the ways and the practices and the ways that we do things, assessing the policies. We're even looking at policies right now to actually assess them for language and racist intent. Like, what does that even mean? That takes work and capacity. And so, yes, have they made a difference yet? No. Are they making a difference incrementally? Yes, because we have leadership, we have people, and we have a community who says they're ready to actually do the hard work of doing this work. And it's part of my job to help mobilize us and make sure that we have the tools and the resources to do the unlearning so we can build the foundation to get to what we all want to get to. And that's going to take time. It's not going to happen before 2024. It's not going to happen before 2030, but we can do some things and build some steps within to measure our progress. And so it's happening. It's a slow work because we've been in this space as a community for 400 plus years plus. And it's going to take more than four years to get, turn us around. So.
Thank you. Ms. Jones?
Yeah, I mean, and you heard Jeff talk about the steps that they have been taking, and I do think that there are some steps that are being made, but of course we still, I think COVID has really shown that even with those best laid steps that had, declaring racism as a public health issue, COVID has said what really is real. I mean, I think we have to actually look at the response to COVID and still the deaths and just the disparities of vaccine. I could keep going on with, and other kinds of things. And I know that that's not all at the Milwaukee County, but just talking about other kinds of things when it comes to structural racism of Black people being healthy and well. One of the things, Jeff talked about that unlearning. I would encourage those who are watching right now, get engaged in the process. If there's something that you do not agree with, or you want to challenge or even ask your policymakers, whether that's the county executive or that's Jeff or anybody elected, you are a constituent, and this is your government. You have a say so. I mean, I know my Black ancestors had no say so in the structures and systems that were created. I'm living now. I definitely have a say so, and I can be a part of the process and changing it so that it's better for Black folks. And of course, you uplift Black folks, you're going to lift up every other community that's also marginalized. So those are the kinds of things that we have to do. And keep in mind that right now, one of the other things is that would help is if we start really building better relationships. We just cannot expect government official grass tops to do everything. We at the community, the grassroots, we have got to get involved.
You, Mr. Holt?
Have things changed? Are they changing for the better? I give the county props because I think the county is shouldering more of the responsibility and has more people committed to systemic change. On the flip side, the city is burdened with a lot more in terms of direct access. You know, I always found it bizarre, redundant, hypocritical that a city of the size of Milwaukee, for example, has not had an MBE program for 10 years. And I'm talking about an MBE program with teeth, you know, not the symbolism gold stuff. But we had a city attorney who said it was illegal, and the politicians never really fought that. Matter of fact, if you actually go back, you'll find out that the straw that broke the camel's back was the Hispanic Chamber of Commerce sued the city and said that the MBE program was discriminatory towards them, even though they had a disproportionately high number of contracts. But, you know, when I was growing up in Milwaukee, we could not live north of Keith Avenue. People don't know that. There were laws in place that forbid us from moving north of Keith Avenue. And when eventually some of those barriers came down, matter of fact, as a small child, I was participating in open housing marches. And I remember crossing that 16th Street viaduct and being exposed to those signs, those racist signs that told us to go back to Africa, among other things, lynching us, etc. You know, when we finally were able to expand, and I don't think anybody on the panel was as old as I am, you know, when we were finally able to move north of Keith Avenue, we actually changed the name of Capitol Drive to Blackfish Bay. Lorraine remembers that. But, you know, that's the system that's the culture we were living in. We couldn't live there. You couldn't file a complaint against the police department unless you own property, and only 10% of us own property. So there were so many barriers. You know, there was a system of educational apartheid, which unfortunately still exists to this day. You know, I went to Rufus King for 3 years. In my final year, I went to North Division. Unfortunately, I had gone to Rufus King because North Division was an antiquated building with ceiling tiles falling around, rats running around the floors, and there was a standing joke. How do you know if somebody went to North Division? Because if you asked them how many states there were, they would say 48. That's how old our history books were. You know, so we are, you know, I can see some of the progress, but the fact that we continue to lead the nation, the United States of America, in 7 negative social indicators as it relates to Black folks speaks volumes about how high of a mountain yet to be climbed.
Thank you.
I also would wish that they would merge the county's Office of Equity with the city Office of African American Affairs. It's the City Office of African American Affairs, and that's, you know, that speaks volumes too. Hasn't done anything, has no resources, and been talking about moving into a building for 2 years. So I don't understand why we have this two different offices. Should merge them into one, and you could probably really tackle some of these issues.
Thank you, Mr. So communities of color are a key target of the tobacco industry. When compared to Milwaukee's white neighborhoods, tobacco retailers in Milwaukee's Black neighborhoods are more likely to sell cheaper tobacco products, advertise menthol outside of the stores, and display cigarettes at child's eye levels. These types of ongoing industry tactics have resulted in tobacco-related disparities. How can Milwaukee address these issues?
You starting with me?
Yeah, it's Mac. Go ahead.
No, you go ahead first. I like piggybacking.
Okay. You know, it's one of the things that we really need to really address, that we need to make sure that that's not happening, because we know that's not happening in suburban neighborhoods. I can go in suburban neighborhoods. I don't see that. Frankly, I don't see a liquor store at every corner either in suburban neighborhoods also too. So when we're talking about, where cigarettes are sold, we really need to be looking at the things that make us unhealthy. And these are strategically targeted at Black people. And I'm going to just say it. This is the slow genocide of Black people. Okay, I'm going to say it again. This is the genocide of Black people. Now, maybe it may not be as immediate as police violence is. Obviously, that is an immediate thing. But, I have my own story with my mom, who got addicted to cigarettes at the age of 16 back in the 60s. And she smoked for a long time, and she died of an illness that is related to smoking. Her flap stopped working, and she aspirated food, and when your flap deteriorates, it will deteriorate faster. Smokers are at a higher rate of having that happen and have a higher rate of dying of aspiration because of it. Most people don't realize that. It's just one of the other health things that they don't tell you about. And I remember having the conversation with my mom, and what she said, she remembers them giving out free cigarettes. So that gets them addicted. So you ever, wonder why Black folks buy certain products? It's because they were given out free back so many years ago, 40s, 50s, 60s, to get them addicted and to get us generationally addicted. And again, that's so corporations can make money at the expense of the genocide of Black people.
I agree with you 1000%. One of the things that disturbed me is that now I'm starting to see cigarette advertising in newspapers and magazines again. I thought they had outlawed that, but the Shepherd Express is running cigarette ads. So this beacon of liberalism that's supposed to be leading us to, the mountaintop, they're contributing to the problem. And I agree. I have to admit that the Black press sustained themselves off of tobacco advertising in the 70s, 80s, and 90s. That is a sad reality. The Community Journal ran them, and because the ads were based upon national advertising rates, so you get more for those ads than you get for any local advertising, etc. But one of the things I've noticed, and it's really been surprising to me, is that I'm starting to see a lot of younger people smoking, Black people, particularly Black males smoking, and they grew up knowing the harm. Now, maybe they think they're immortal and they can smoke, blah, blah, blah. I have to admit too, I smoked up until about 8-10 years ago. But a pack of cigarettes are like $7, $8 a pack now. And I'm seeing these young folks, and I don't know why, but I'm seeing all of these young folks smoking again. And I also know for a fact, there is a store right across the street from the Community Journal, one of the little corner stores. I have seen kids, 15, 16, and I've stopped a couple, walking out of there with blunts. So yeah, I know they used to do, different agencies used to do these little tests, where they would go in and see, have a young person buy. They need to really push that again too, and I think for some reason, smoking seems to increase as we go through some kind of economic turmoil. Maybe it's for the same reason, maybe alcohol is, but to go back to what you were saying, I'm seeing, it's not an accident that I'm seeing all these new liquor stores popping up in Central City too. And what they're doing is, there's one little chain, there's one on Fond du Lac, and there's now one on like 40 something in Hampton. They sell themselves as a grocery store, and then you see these gigantic signs They say liquor, once they open. I think we have enough liquor stores around, and we have, during my day, they sold cigarettes in those machines. I guess they cost so much a pack now, you can't afford to put nothing in them and just get a credit card. But I think if we did more scrutiny, push education and tied it into personalities, like saying you'll never, since half of the Black youth think they're going to be basketball players, saying LeBron James could not run up and down that court, if he was a regular smoker. But I agree with you, it is a conspiracy.
Mr. Roman?
Yeah, so how can we address the issue in our communities? I think for me, it's about building capacity. When I'm talking about building capacity, I'm talking about 3 specific things: building the leadership, building the organizational, and building the advocacy capacity of residents, so that they have the power and they're empowered to do what we're talking about doing. And our role is to support them so that they can do that. Residents should have the support and have the be empowered to be able to make decisions for what's best for themselves and their communities, and their families. And what we can do in Milwaukee is make sure that they have the resources to do that. We need to invest in leveling the playing field in our communities. We need to invest in the communities that have been ravaged by big business and the tobacco industry and the alcohol industry and all those industries. We have to make sure that we're leveling the playing field, investing in those communities so that they are not vulnerable to those forces. And we do that by redistributing resources and power to communities and building their capacity so that they can define what they want and what they need. And I think that government should actually bear a large part of that burden and that responsibility, because societies and communities are built upon, upheld, and in all cases, if not most, if not all cases, are regulated by government. And governments are and have been responsible for the laws and the policies that allow big business and the power elite to do the things that they do to our communities. And so it is our responsibilities, but it takes government to acknowledge that, understand that, and then make intentional investment to correct that. And that takes work, and that takes a lot of time. And it actually is, it's about busting up the status quo that exists within our institution. That's the work.
Thank you, Mr. Roman. For this next question, this is our last question before we move into the audience portion, but we'll switch the order a little bit. I'm going to let you go ahead and start off, Mr. Roman, and then we'll go to Ms. Jones, and then we'll go to Mr. Holt. So many of us here today understand the health toll that menthol tobacco, which has been targeted toward communities of color, Black communities for decades, has had. One recent study quantified menthol as being responsible for 1.5 million life years lost for Black Americans over a 38-year period that ended in 2018. Yet, some still question the need to stop menthol tobacco from being sold in America, with even some Black leaders, some we know that have been swayed by industry dollars, saying it could lead to more harm than good in terms of possible police interactions. What are your reactions to this? And do you believe that a prohibition of menthol is needed in America?
I mean, I think it's true. I think this is big part, the pharmaceutical, the tobacco, they're not doing anything different than anybody else. And so I think that there needs to be more regulation, more laws, more oversight on how they are ravaging communities. And should there be a menthol ban? I don't know what that looks like. I don't know. I think that there should be more regulation though, and there should be more oversight, and there should be more accountability for the businesses that exploit our communities, and create the conditions to do that. And I'll say it again, government has to play a more proactive part in making sure that we're holding those businesses accountable, which means that we got to get some folk who understand what's needed to be in those positions in government, so that governments aren't used as tools. Government is used as a tool for racism and for inequities. Let's be clear about that. We have to have folk within positions of power at the local, at the state, at the federal level who understand that and who are committed to working for dismantling that within the system, so that there's more oversight, more accountability, whether that's through a ban, whether that's through restrictions, whether that's through whatever it is. Those are the conversations that we need to have. And unfortunately, we live in a society that is conditioned to support and enforce the systems of oppression that create the conditions in our community.
Thank you, Ms. Bowman. Ms. Jones?
I have no problems with banning menthol. I mean, do we have watermelon flavored cigarettes? Do we have orange flavored cigarettes? I mean, I'm just saying, so why is there a problem with this particular flavor of cigarettes being banned when there aren't any other ones? I mean, I think, is it because, you know, like I said, this is the genocide of Black people, and that and our corporations seeing, well, we know that corporations are seeing Black people as dollar signs to be used and abused. And then, of course, if they're smokers, sometimes they can pass that habit on to their children. I mean, I'm just saying, this is big money, and if we want to interrupt money, we have to come up with some bold ideas. Banning flavored cigarettes is a step. You know, we need to have much more education and things like that, so that children don't get started, you know, on that. And we need to figure out ways. And here's the thing is that also too, talking about cigarettes, are we even really training folks, or because there's so much chaos in our society of how to deal with their issues and problems, so that they don't have to go to cigarettes or alcohol or whatever it is to self-medicate. My mom was a chain smoker, and when she would get anxious, she would have cigarette after cigarette. I'd be like, Mom, you just had, like, I'm sitting here, you know how many cigarettes you just had in an hour? And she had no idea that she would just smoking because she was anxious about something. And so those are the kinds of things that we need to ban, and how to deal with better mental health with our problems.
Thank you.
I thought I read that President Biden had undertaken some reforms that would ban menthol in some form or another. I unfortunately am always leery of censorship in any shape, manner, or form, because it often backfires on us. You know, I remember having to testify one time. Well, I was at a public hearing about a proposal to stop the Nazi Party in Milwaukee from distributing hate literature around schools. This was right after desegregation, and the only person who was opposed to it was named Arthur Jones. He was the head of the Nazi Party in Milwaukee. See, again, Lorraine is old enough; she's the only one that knows what we're talking about. So he was there in his full Nazi uniform, etc. And as I was listening to him, and I'm standing in the room as a reporter, you know, and the room was packed. As I'm listening to him, and I'm reading the actual resolution, which was actually drafted by Orville Pitts, who was assistant city attorney at the time, and an alderman, in case anybody goes back that far. When he finished speaking, the chair of the committee asked, was there anybody else who would like to speak against the ordinance? And I looked around and shrugged my shoulders and bit my lip and said, me. And I ended up following him, saying that based upon the wording of the actual ordinance, they could ban the community journal, because it was any literature that went against, quote unquote, the status quo, but they never just explain what the status quo is. And you live in the most segregated city in the United States with all these negative social indicators, somebody is dictating what the status quo is, and it is not popular to us. So only for that reason, I'm interested, where I'd be hesitant about outlawing menthol. Then plus, you know, you can go to these little stores, which are also popping up quicker than liquor stores, where you can buy these vape pens and stuff, and you can get any flavor you want, including the watermelon.
Senator Taylor has her hand up.
Sorry, Senator Taylor, go ahead.
Thank you. The first thing I wanted to piggyback on was I wanted to actually speak to the very issue that Mike Holt just spoke to. In particular, I was at a conference, and what I found and I heard for the first time ever was an argument from Black law enforcement speaking on the issue of the menthol ban. And not that they support menthol, but that they are concerned that what the ban does and that it gives, I don't want to say authority, but a reason for law enforcement to have interaction. They brought up the Eric Garner matter, death, killing. And so it's something that I've learned in the process of being a legislator, the unintended consequences that sometimes happen from something that might be something I support wholeheartedly, might be something we want to see happen, but its implementation is such that it may promote disparate treatment. And so that was one of the things that they brought up, and they brought up the fact that there was a lack of diversity on forces, so that you don't have someone necessarily to be able to be culturally competent when they're doing whatever those interactions might be. It made me think about the single sale cigarette legislation that we did in Wisconsin, and how in turn then it helps to promote stopping folks because they selling cigarettes, and how that in turn is handled or how people are treated. So I think it's kind of like the same thing I think about when people speak about fighting for $15 an hour. First of all, if you look at what the minimum wage was and what it should be now, if it got its increases, it would be 25. And then if you look at 15, if individuals who are on government assistance get the $15 an hour, then they're probably not going to be eligible for things like childcare, their subsidized housing, maybe even food stamps. So what are you doing so that as they get the increase, you're dealing with that too? So what I say in regards to the menthol ban is we have to think about collectively what happens with that, and maybe begin in your advocacy to put in the pieces to deal with the unintended consequences that come from some of the things that you're promoting. And I think it's important, especially when I see a nationwide movement, to put it on the minds of legislators. And I have to be honest with you, it's something I had not thought about. It's something that I think has some legitimacy to it, especially in a place where we lead in the nation for the worst place to raise a Black child and be a Black American. And there are disparities that exist within our police department, such that the ACLU had to sue and the DOJ had to give recommendations of what we should do, and our city is not in compliance. And one of those things being very close to what would happen with someone selling cigarettes, which is stop and frisk. And you have someone sitting in front of you who's a candidate for mayor whose son was carrying a turkey, a frozen turkey, to a neighbor, and was stopped and treated more seriously than Carl Rittenhouse, who was carrying an AK 15, AR-15, an AR-15 in another city in the state, but he didn't even get stopped. When he had his hands up and people said he shot 2 people and he harmed another. So, and by the way, on that day, the police department was giving away food. So they didn't even at the end, after putting him in the vehicle, after him completely cooperating, put him in the vehicle, locked him in the vehicle. He was not free to go. So I have to think about those interactions. So there's some truth in what the police have said that I heard at that conference, but we know that we have the data that shows, what the racism that has existed in promoting tobacco, and not just promoting tobacco, but what menthol has done. I mean, Lisa has hit it out the park, and Mike and the rest of you on the issue. So I just want to make sure that you know that that conversation is exactly how you said, Edgar, it's happening, right? But I don't think we can just dismiss it, because I think it's legitimate. Black men in this city, you know, experience what my son experienced as an unwanted rites of passage.
So can I just real quick, I'm gonna jump in and then I'll be brief because I know we want to hear other people. Just a few things to consider in terms of the menthol ban. The FDA is currently being sued because the menthol ban, as Lisa said, or menthol, that product is a multi-billion-dollar industry. People are making money off of our health. So that is why the FDA is finally taking a look at it. They're being sued. They're being sued by some of my colleagues that I work with. Secondly, when we talk about unintended consequences, earlier on when we opened up, we talked about unintended consequences that have led to death in terms of Sandra Bland, Michael Brown, George Floyd, and we can go on. So we're going to say, stay tuned. This is prompting me to have another session that just deals with menthol. That's all I want to say. And Edgar, please continue.
Thank you. We're running out of time, so I'm going to ask just a last question from our guests, and then I'm going to give them each a minute to give a final thought, and then I just have a few announcements, and then we'll close out. But this question is for some guidance on unlearning. This is something everyone has to engage in. What 2 actions would you recommend are most important for a person to take to initiate unlearning? And I know, Jeff, I'll let you start. I know you started that discussion on unlearning.
What 2 items? I actually have 3, and this is the work that we do, that we're not forced to do, that we need to do, and this is where a lot of my time is, and I get that question a lot. Where do we start? 3 things. It starts with reflection, your own self-reflection, and looking at yourself. What are your biases? What have you learned? Where did you come from, and how has that influenced and conditioned and informed your world perspective? It starts there. Taking time to reflect on what that is and how it impacts and shows up in your everyday walk, on your job, at your church, in your community, wherever that is. Second, it's engaging, actually talking with people of color and people who are oppressed and impacted by these disparities. That's 2. Building relationships and learning from their experience, and being open to learning and hearing about experiences that are different than yours. And then the third one is educate yourself. This is the age, the digital age. There's so many museums, virtual museums, and resources and books to educate yourselves so that there's a counter narrative to what you've heard and learned all of your life. And it doesn't matter how old you are. We all get started in this world with key messages and key frames about people that build our biases and build our perspectives. And so start with self-reflection, engage and build relationships and get to know other people who don't have your same experience, and take the time, build in the time to educate yourself and open your view, to immerse yourself and open your view to the diversity of the world that exists around you. We often keep ourselves in bubbles. Open yourselves, pop that bubble, and immerse yourself into that diverse world.
Thank you. Ms. Jones?
Yeah, I want to piggyback on what Jeff was saying. Yeah, you need to do your own internal work. We all have biases. So this is not just about, white privilege, or, we all have biases. There's sexism. Work on yourself. Do not continue to go with it's always been this way, the propaganda, the toxic masculinity, the racism. You don't have to live like that. None of us have to. But we have to, but I do believe that if we want to get to the beloved community that Dr. King talked about, we're going to have to keep working on ourselves to keep unpacking that. Now, with that does not mean you work on yourself and you just work on yourself to be a good human and to be the best human, and let the rest of them humans just, oh, well, that's them. So that's not that, okay? So the other thing is that needs to be done is, so you work on yourself, but yet as you work on yourself and making yourself a better human, also too, remember you have to interact with other humans. And so we need to find a justice home. MICAH is one place you can find a justice home. We are not the only one. There are multiple groups doing multiple different things on justice issues. Everybody has a calling, whether it's criminal justice, or education. I'm a faith person, and the dear Lord made plenty of humans, and the dear Lord works through all of you. So that means that we can't have anybody sidelined. If you are sidelined and afraid, then find other people who you can engage with. And just like Jeff said, find relationships. That's why you need a justice home. Find a justice home to do this advocacy. So then you're not by yourself. You won't feel alone, and you can't say, I don't know what to do. There's a place for you. It's up to you to find out where you need to be.
Thank you, Mr. Holt.
Well, I agree with what was said. 2 points. One, be honest with yourself. Most racists don't know they're racist. Most victims don't know that they're victims or how they contribute to their own victimization. So be honest with yourself. Do a self-assessment. Ask yourself some questions, some very, very simple questions. Why, do you believe certain things? Why do you act a certain way? I think as Lisa said, God, the good Lord, she said, created the human race. That's all he created. Or she. It was not a black race, a white race, or whatever. There's only one race. And if you want to be honest, I spell the human race Hueman. The human race. There's only one. There's so much division. You want to end racism? Then end race. The other thing is understand your power. One of my favorite poems, and I don't know where I got it from, but it. And I'll just give you the one sentence. A tiny footprint in the sand can change the course of the mighty ocean. Mm-hmm. Think that through. If you go to the lake, much less the sea, but if you go to the lake, standing on that lakefront, in that sand, that footprint just changed the direction, current, and everything. It changed history. It determined how much water went into Chicago. So think of in terms of that, your one little footstep. So do one thing. Think of, you can start something very, very simple, like saying hello to people. But you have the power to change the world, and everything you do changes the world every microsecond.
Thank you. I really appreciate you all today. I'm going to give each of our panelists 1 minute for a brief final statement, and then I'm going to make a few announcements, and then we'll close out. But I'll go ahead and let you go ahead and start with your final statement first, Mr. Holt.
My final statement. I'm afraid. I really appreciate what Michael's doing. I really appreciate what Jeff is doing. I appreciate what Senator Taylor is doing and what she's attempted to do over the years, shaking the tree. And I think we need more tree shakers right now, because I read a report yesterday that came out, and it was time to coincide with the Martin Luther King holiday. And the report was, which states have made the most racial progress since Martin Luther King's assassination? It was actually 50 states and the District of Columbia. They just included that in there. Guess who was number 50? Wisconsin. Mm-hmm. Wisconsin. Think about that. You got the mayoral election coming up and all this other kind of stuff. One of the things I learned is, legislation, you cannot legislate attitude. So you're not going to end racism that way. You can deal with some of the effects of it. But we lead the nation, as we did 10 years ago, in 7 negative social indicators. We have the lowest percentage of Black children who could read at proficiency levels in the 4th and 8th grade. My column this week is they're 2 years behind and probably will never catch up because of this perfect storm. We got the highest infant mortality rate, the highest Black male unemployment rate. We're the most segregated city in the United States. We get the widest gap between white, Black academic achievement in the United States of America. there's 7 listed. I can give you 20. I'm somewhat fearful. Maybe we just need to do some self-reflection. I think somebody really needs to shake the tree because the status quo has not changed the status quo. I'll leave you with this little adage that my wife uses all the time. Think about this. If nothing changes, nothing changes.
Thank you so much. Mr. Roman?
Yeah, I will leave you with this. And when I say it, a lot of people don't agree, but I'm going to say it anyway because it just is what it is. The burden of eliminating racism, the burden of fixing our communities and improving community conditions, and the burden of keeping our communities and our families well and safe and healthy, it's not the responsibility. It should not fall on the backs of those communities that are surviving within the system. They didn't create those conditions. We're surviving in those conditions. Some of us do well, far more well than others. Many of us don't. But it's not our burden. It's not those communities' burden to fix the things that they did not create. The systems, government, business, all those things, those are who are responsible, who should bear the overwhelming burden of this work, of this task. And until we point our fingers that way, instead of them pointing their fingers this way, we're going to continue to have these conversations and continue to be in here. The burden should not be on the backs of those who are impacted by the oppressed. And until we figure that out and build our capacity to mount a counter campaign against that, we're going to continue to be in these conditions. But I will say this in the end, those systems are built by people. Those systems, governments, businesses, are made and upheld by people. And so it takes, to the other panelist's point, you have to do your own work. You have to change your mind, you have to change your heart, and you have to commit to forcing yourself and your sphere of influence to change how they operate so that everything works together. And thank you for the time today.
Thank you, Mr. Roman. Ms. Jones?
Yeah, we're at a time where we can change the systems of oppression. I call them systems of oppressions because there's multiple. I mean, racism is by far the greatest, but there's sexism, there's homophobia, transphobia. I could keep going on. All of those things are harming us, and we are not a healthy society, and we really need to do that real deep dive. Those on this call, those watching this, get involved. Get involved. Do not assume that your legislator, I don't care what party it is, shares your values. For one thing, you don't know if you may not know if they completely share their values. And there's always things that go back and forth because, looking at always at the election, vote in every election. We see what's going on in school boards right now about masks and everything like that. And if you care about racism in the schools, you care about all of these things, you care about curriculum, teaching the truth, learning about Black history. Look, American history is Black history. Yep. Okay. Right. So it shouldn't just be once a month. So I'm just saying that there are things that you can do. Do not think that you can't do anything. The change starts within you and how you use your voice, your vote, your time, your talent, your money, all of those things. You have an influence as a person. God works through people. You want to know where God is? God is in you, and he's working in you, and he expects you to answer the call to change the systems of oppression. And you're welcome to join us at MICAH or any of our work to do any of that, because we need people so that we can get out of the silos and we can make Milwaukee not the worst for Black people, but we're going to say in 20 years, look what they did in Milwaukee. Look what them folks did in Milwaukee. And we are doing that grounding right now, and you can join us.
We can do it too.
You can do it.
Y'all know we used to be like a trailblazing place for Black people.
We can get back there.
Amen.
Yes, and I'd like to thank our amazing panelists and our guests for this wonderful discussion. A few announcements. We are hosting MLK Day of Service events throughout the weekend. So there'll be some retailer engagement going on tomorrow in the city of Milwaukee, retailer engagement happening Sunday with suburban retailers. On Monday is the big MLK Day event at the Quality of Life Center. There will be COVID shots, flu shots, food giveaways, some other gifts while supplies last. We need volunteers for all events. And also Monday, we'll be hosting a virtual letter writing workshop from noon to 1. So please, I put the chat in the link a few times. Please join, click on that chat and register for one of those events, or register to join the Health, Equity, and Social Justice Subcommittee, or our mental health subcommittee, our smoke-free housing subcommittee. Thank you for that. After participating in this discussion, please let us know your thoughts. What do you think we should focus on? How can we move this work forward and visualize and make happen all these wonderful things that we talked about today? I do want to let everyone know that the next virtual meeting of the Health, Equity, and Social Justice Subcommittee is Tuesday, February 15th, 2022 from 10 to 11 a.m. And I'll now hand off to Director Lorraine Lathan to close.
Actually,
can I ask one question about the work that you said that was going to be happening at the retail spaces?
Yes.
What is that exactly? Is that some of the kind of thing that Mr. Holt spoke about should be happening? You know, like sending folks in to see if they're doing things right?
Yeah, so you'll be glad to know that the compliance checks that were part of the Wisconsin WINS program, they were suspended due to the COVID pandemic, but they will be resuming in Milwaukee and the suburbs in the next month or two. But this specific volunteer event on Saturday and Sunday, this is our part of our outreach to retailers to let them know about the Tobacco 21 law, to give them posters to hang up to help them with their customers so that they don't get into conflicts with their customers who are under the age of 21 who want to buy tobacco. And
got you.
Program. So.
That sounds great. And I just want to remind you guys that your next meeting, it's only an hour, but please remember at that meeting to remind people that it's election day.
Oh,
and that's all.
We might change the day of that meeting.
You might.
So.
Thank you, because I would like everyone to be out in the streets.
We'll be there. So Lorraine, did you have a final thought, closing word?
I would just like to thank everyone, the panelists. This was amazing discussion. It is what we envisioned. We just wanted to have very provocative discussion, and I'd like to thank everyone for attending and just encourage people. We also are working in public housing. Today, we're doing rapid testing and door-to-door work in public housing. We have 3 very active committees. This is the newest one. So please join us as we try to make a difference in our communities. So thank you, thank you, thank you.
Ms. Lorraine.
Yes.
In regards to the work that you're doing in public housing, the same way that you did this, virtual setting, what I found in public housing is that they've had some issues, not as severe as in other states where people have died in public housing because the maintenance has not been what it needs to be. But everything from roaches and bed bugs and other things that are health challenges, I would argue, and quality of life challenges that they may have. But also I found that they're not very engaged civically. So, as you're talking to them about being involved in a way that's on the front lines to help against COVID-19, I'm just encouraged, because I think you are building up a generation of individuals by teaching them to be engaged with their elected officials. Although you've done it originally around one topic, now you're branching out into health more. Yes, ma'am. And I want to say to you, while you're there with those people, while you're in that facility, to consider engaging them, because polling locations are often in those places. And so those people often, as in our community, often feel, I don't want to say hopeless, but not as engaged. And so as you expand, I guess I'm trying to say, maybe expand and figure a way to merge some of what you're doing with those residents, if not now, at least in the future, because they need to have a voice and they need to learn what you're teaching our babies.
Thank you, thank you. Yes, it's been amazing. I mean, we we go out 3 days a week, and we're reaching thousands and thousands of people. We're handing out face masks, we're doing the rapid testing, and clearly we can add more. We always talk about getting out to vote, and it's important to vote. So again, thank you for just recognizing our work, and we look forward to connecting with everybody again in February.
One more thing, Lorraine, I'm sorry, I forgot to mention, but we are seeking a second co-chair for the Health Equity and Social Justice Subcommittee, and we do have one co-chair identified, Mr. John L. Morris. He's on with us today, and you'll meet him during our next meeting, but we are seeking a second co-chair. So if you're interested, please, and we're looking for community members, people in nonprofits, whoever wants to dedicate some time to this effort, please join us.